Hi, today I'm going to explore drug absorption. I'm just going to briefly explore this concept and try to make this clear as possible. So simply defined, drug absorption involves the movement of a drug into the bloodstream. And so there are many phases involved in this process. Firstly, the drug needs to be administered into the patient, and there are several routes through which this can occur. For instance, the drug could be administered orally, rectally, through an IV, or subcutaneously, which is an injection just under the skin. The drug must also be in a particular dosage form, which would be specific to the patient. For instance, a tablet, a capsule, or even a topical gel. So following administration, the process of absorption begins. The route of administration, as well as the solubility of the drug, can affect the rate of absorption. For instance, IV administration would be the fastest as the drug is being injected directly into the bloodstream, whereas oral administration is a slower process as the drug must travel down the GI tract before being absorbed. So once the drug reaches the stomach, it must be dissolved. The drug must, in order to be dissolved, it must cross many semi-permeable cell membranes before reaching the systemic circulation. Simply put, cell membranes are barriers that selectively prevent the movement of drug molecules into the circulation. Depending on the chemical makeup of the drug, it can be absorbed either immediately in the stomach if it's of more of an acidic nature, or alternatively further down the GI tract, so either in the liver or intestines. Most drugs are actually absorbed in the small intestines as it has a larger surface area and the membranes are more permeable than those in the stomach. So basically, absorption can occur through the process of passive diffusion or active transport. I would say the major difference between these two is that in passive diffusion, the drug moves from a region of higher concentration to one of a lower concentration. Most drugs are actually absorbed this way. Lipid-soluble drugs freely move across membranes because of their solubility in the membrane bilayers, whereas water-soluble drugs penetrate the cell through the cell membranes through aqueous channels or pores. Other drugs require specialized transmembrane carrier proteins that facilitate the pathway of those larger molecules. This is known as facilitated diffusion. So simply put, passive diffusion does not require energy to enter the bloodstream. On the other hand, the process of active transport does require energy. So unlike passive diffusion, it is able to move drug against a concentration gradient. So meaning that it can be diffused from, and as I explained, from an area of a lower concentration to one of a higher. So I hope I've made things clear about the concept of drug absorption. And yeah, thank you for watching.